doctor. So my first question to you is, what is your thought on repeated miscarriages, like a couple who is experiencing bleeding in the first 3 months of the pregnancy?
So when a couple experiences the risk of miscarriage, as you said, there is a risk of bleeding in the first 3 months of pregnancy. Apart from emotional care,
Okay.
the couple nowadays wants to know the answers.
Yes.
And the thought process of them I have seen is they would want to know an action plan,
Yes.
which is available in the medical world.
Okay.
What is the best treatment available? And if it is possible to save the pregnancy, then they would want to save the pregnancy from miscarriages. This is the first thought that comes to any couple's mind when they are having a risk of miscarriages.
Okay. A lot of women ask, should I take complete bed rest to save my child?
Okay, so you mean to say that in first 3 months of pregnancy, when the patient takes complete bed rest, suppose they had a risk of miscarriage before, and they would want to save this pregnancy, and they want complete bed rest.
Yes.
So in these situations, what happens is, whenever somebody is pregnant, it is important that they don't do overexertion. They don't go for long travels. They should not get infections like urine infection, cough, cold, malaria, any infection, because that would pose an additional risk factor for their pregnancy.
Okay.
But apart from that, suppose a lady who is conceived and she has PCOD before. So she was obese or she had metabolic problems. Or any normally menstruating woman, she's pregnant. Now, once a lady goes on the bed rest in the first 3 months, it can badly affect her metabolism.
Okay.
Which in fact can lead to more miscarriage risk.
Okay.
So, and more stress during the bed rest also causes to the more stress increase.
Yes.
That how this will go, the work is lost. So because of the work loss, the stress increases.
Yes.
So it is better that we look at the pregnancy in a scientific way. We look at how is the baby.
Yes.
How is the uterus. And we look at what are the correctable factors to avoid miscarriages than to go on a complete bed rest. We usually say this in our all IVF patients that if by bed rest pregnancy was going to come 100%, then we would have kept all our patients in the hospital for 14 days.
True, yes.
But we don't do that. Nowhere in the world it is done. So it is important to advise the woman on adequate physical mobility, avoid the emotional and physical stress, but live life at comfortable pace so that the whole journey doesn't become overwhelming.
Yes. What is genetic testing, by the way?
Genetic testing is advised to couples who have a history of miscarriages.
Okay.
Now, it is expensive to do genetic testing, apart from routine karyotyping testing. So, how we should approach whether a couple needs a genetic testing or does not need will be looked at like this. 90% of the couples who are between age of suppose 25 to 35 years of age and have had miscarriages, 90% of that couples will not have any history of genetic diseases in their family. So they don't have any history of genetic diseases in the family. Then still they are having miscarriages. So even before we advise genetic testing for a couple, we should approach the whole algorithm in a way that we reduce the reducible risk factors for miscarriage. How? We can correct the egg quality. We can give supplements to increase the egg quality. We can reduce the PCOD. We can give treatment to the male so that the sperm factor also improves, which in turn will give a healthy embryo. Then we can treat infections. We can give probiotics. We can correct the lifestyle and modifiable factors and see and keep a background of genetic testing if the expert feels they need to go for genetic testing, then only we advise genetic testing. Otherwise, 60 to 70% of the times, correction of all these factors will reduce the risk of further miscarriages in a couple.
Yes.
And then if needed, we have to advise for genetic testing.
Yes, true.